Hi everyone, welcome to researchmd.com. Another great presentation. We go into our topic again today is COVID. We know it's a global pandemic, and we're going to look at the eye symptoms of COVID-19 positive children. Okay. Again, my name is Pramil Cheriyath. I'm a director of research. I teach medicine residents, students from two medical schools, and I'm also program director, internal medicine and transitional residency program. Okay. So let's talk briefly about COVID-19. We've heard the global pandemic we have never seen in so many years. Overall around like 418 million infected people already in the world, and close to 6 million people already dead. And it can affect from children all the way to elderly people. Okay, usually spread by the infected person, by droplets when they cough, or the surfaces and all that. So most common symptoms, if you look at all together, virus found in the respiratory secretion. So clinical fears, fever, fatigue, dry cough. Symptoms of adults and the children is slightly different. So there are reports about eye symptoms, increased eye symptoms in children, but compared to the adult, children are getting more eye symptoms in COVID. So that is our whole purpose of this presentation today. So what is the pathophysiology? How does somebody get an infection in the eye with the COVID? Okay, just like COVID attack all the surfaces, right? Its ocular surface communicate with the air just like nasal mucosa. So you can, all these particles or virus can really, it's an open surface, can come and hit the eye. So, and also you have this nasolacrimal duct, right? When you have like symptoms in the nose, and this nasolacrimal duct, we drew a nice picture, kind of connected to the eye, and this virus can travel to the eye also. Two ways can it. One is like, come from the surface. It's an open surface, kind come and hit it, and then nasal mucosa, just like nasal mucosa, the ocular surface get affected, okay? And then you have this nasolacrimal duct. And then also you have this ACE2 inhibitors. That's a binding site for the COVID. So that also present in apparently a lot of them in the ocular tissue that make for the virus to enter the eye faster. So modes of contact would be like, usually the kids are like always rubbing their eye, hand-eye contact, nasopharyngeal secretions pushed into the conjunctiva, when people cough, when the kids or somebody cough and kind of go through the conjunctival. So both ways it can affect. So we found this nice study published in JAMA looking at the ocular manifestation, and there was 216 kids. The median age of the kids were like 7.25 years, 62% were boys, okay? So let's look at it. So all this, out of 216 kids, 22% of the people had like some ocular manifestation. That's concerning. When you look at the adult, they don't have that much. You don't see that many patients, very rare, maybe like 1 to 2%. But in the kids, there's 22% or 23% children had ocular manifestation. So out of this 22, what were their symptoms of presentation? 55% had conjunctival discharge, remember that. And yellow or green purulent discharge in 11%, white mucoid discharge in 9%, thin watery discharge in 7%. Okay, remember, majority of them had 55.1% have conjunctival discharge. Eye rubbing 19%, conjunctival congestion in 5%, ocular pain in 4%, eye swelling in 4%, and tearing in 2%. Okay, so if you look at overall the symptoms, they last only like 7 days. Usually like, after 7 days, the symptoms kind of disappear. So that is also very important. Thank you so much for watching today. We'll be back with another presentation. Please subscribe to our channel.